Erlanger serves as the Level 1 Trauma Center for Southeast Tennessee as well as the surrounding region. More than 100,000 patients visit Erlanger's emergency department each year. Many of these visits are trauma related. The leading cause of trauma injuries are motor vehicle crashes, falls, motorcycle crashes. As a matter of fact, in 2008, there were 2,724 admissions to Erlanger due to trauma-related injuries, and that's what we're going to talk about today. Beth Jordan, who's program manager, and Dr. Donald Barker, who's trauma surgeon, as well as medical director of the Trauma Center. Welcome to our program.
Thank you.
Do people just get kind of crazy when it starts getting pretty weather? Is that about the only way to really describe what happens?
We do see that. We see an increase in motor vehicle crashes, boating accidents, ATV crashes when the weather gets warm.
Huh. And a lot of it is probably from what they partake of, isn't it? Alcohol?
Part of it is people start to have fun, start to party a little bit too much sometimes, and get in trouble. Their judgment gets a bit impaired, and if they're operating any sort of motorized vehicle, cars, motorcycles, ATVs, a big problem we have around here. They just don't have the ability to make the judgments and do the things necessary to keep themselves out of trouble.
Yeah. Are ATVs like the #1 cause, or is it kind of a 1A, 1B, 1C things?
We see mostly motor vehicle crashes from cars. I think that we probably see ATVs as the second most frequent type of motorized vehicle injury we see, because they're so prominent throughout the community, and we see them with adults, elderly people, and even small children. I guess the third would probably be motorcycles.
Yeah. Why are these always referred to as trauma injuries? Is it because simply it causes trauma to your body, your heart, lungs, everything else?
Correct.
Sure. Yeah. It's any injury or any type of injury that causes soft tissue trauma to the bones, trauma to your body. Disruption of organ systems or disruption of the tissue is pretty much referred to as trauma.
All right, there's a trauma symposium coming up soon. Tell me about it.
There is, next Wednesday, April the 1st.
Okay.
Yes.
Who's it for?
It is for medical professionals who have an interest in trauma. It's open to anyone, whether you work with trauma patients or not. We attract pre-hospital people, EMS workers, firefighters, nurses, physicians from the area.
Do you also, is it a time where I guess you could say some of the newer techniques may be gone over?
Correct, yes. New literature, new research, yes.
Because things change all the time.
Correct.
What do people do to get involved in this? Just call?
They call me, yes.
Okay, they call you. And they call you what? Oh, no, we won't do that.
You can call me Beth. They can reach me at 778-6704. And we do still have slots open.
Good. And we'll put that on our website as well. Thank you all. We appreciate it very much.
Thank you.
Now we're going to zip off to the kitchen. You know why? Mr. Food is tinkering with kitchen gadgets.
Top's on our minds these